Life. Big, beautiful, beckoning. 7 billion points of human connection to share love and story and friendship. A brain that can solve the most complicated puzzles, a body to explore the kinesthetics of creation, kinship with animal and sustenance with vegetable, the smell of a flower, the taste of dark wine and sharp cheese, the electrifying buzz of an electric guitar. Paradise. Here. Now. Paradise. Unless it isn't. The trauma of war, the yoke of addiction, the relentless pressure of anxiety, the gray void of depression, turning heaven to hell. Life is suffering, it is said. Fuck that. That's not what we're here for. We just need a little help. The world we live in has moved too fast for our human to keep up. Too far from nature, too much distraction, constant stimulation driving our isolation, our sense of purpose replaced by the false panacea of comfort. We reach for a cure, most of us find none. There are treatments that do not heal and escapes that mask the pain, but we do not find a cure. What if I told you the cure was near? That we no longer needed to carry the trauma in our lives, that we could shed our depression and anxiety as the great boa sheds its skin, in one whole piece. This is not the elusive promise of a mystic or the shiny lure of a charlatan. These are conclusions drawn from hard science. 2 double-blind placebo-controlled trials conducted by the nonprofit organizations Hefter and USONA have shown that 1 dose of psilocybin in the hands of a skilled therapist has cured depression and anxiety in 80% of the patients studied. A single dose. And those terrified at the end of life were given a reprieve from the hounds of their own hell. A single dose cure. From a compound that can never be patented because it grows wild all over the world. The magic mushroom that in clinical research has been shown to reliably produce top 5 life experiences and drive a deepening spiritual connection amongst the leaders of major religions. And trauma, post-traumatic stress disorder, the plague of our heroes, those fighting for our fellow man, those who boldly walk toward the burning buildings and come home with a wound that no one else can see, consuming their joy, driving dozens of suicides a day in the active military alone. In the worst cases of trauma, those who traditional medicine has failed, there are cures happening. MAPS.org, in multi-site phase 2 clinical studies, has shown that MDMA-assisted psychotherapy has been able to reduce PTSD below the clinical threshold for 2 out of every 3 patients, and continue to reduce it years later after just 3 sessions. These are not treatments, but cures, saving families, ending cycles of multi-generational trauma. And side effects? There are some that'll show up in the clinical reports, and some that you won't see. Euphoria, empathy, deepening connection with loved ones. The statistics will tell you that 15 million Americans suffer from depression, 3 million from anxiety, and 25 million suffer from trauma. But they are the ones who stand up to be counted. How many others stoically carry these burdens without reporting, but suffer daily? The cure is near. Like the sun breaking over a bleak horizon, help is on the way. The next step is to expand the studies from phase 2 to phase 3. Successful phase 3 trials will put psychedelic medicines in the hands of the skilled practitioners, so finally they can do the work they are here to do, to cure their brothers and sisters. The nonprofit organizations running the trials are not here to make money. They do not have shareholders or quarterly earnings. They rely on our support, donations from those of us who care. This is real. It could be the answer to prayers, the reward for faith, the reason for hope. Is it a guarantee? Of course not. But it's the best chance we got. This is not a time for fear and propaganda and prejudice. This is a time for compassion and action. Join me in the fight. Visit thecureisnear.com for more information and to see the donation options available.